Okay, I'm interviewing Dr. JoLynne Grant. She is a doctor of veterinary medicine, and she's going to talk a little bit about her decisions to become a vet, how she made it, struggles along the way, and what she does on the job. So, my first question is, what made you want to become a vet? What inspired you?
Well, Kate, I always enjoyed working with animals, and I also loved the sciences and math when I was in high school. And so, being a veterinarian kind of incorporated both working with animals and then, using scientific principles to, determine the best method of treatment for animals.
And your first steps in becoming a vet, after you realized, man, this is really what you want to do, what were they? I mean, did you apply to colleges? Obviously, MSU was your school of choice. So, how did that all work for you?
Well, you had to have certain courses in undergrad. So I got a 4-year degree in biology with a minor in chemistry, my bachelor's degree. Um, and obviously that was heavy in the sciences. Then when I was ready to apply to vet school, I was working on my master's degree, so I had a fallback plan. I think that's real important because to get into veterinary schools is real competitive, and everybody doesn't get in. And there's only about 26 veterinary schools in the country. There's only one in Michigan. There's probably 4 times as many medical schools. And so the odds of getting to be picked for one of those 100 people, you have to be really good and you have to really have a well-rounded education. They want people not only that are straight A students, they take people that aren't straight A students, but you also need to be well-rounded as far as outside activities. They want to see people that can talk and interact with other people. So they look for what kinds of clubs you've been in. Or have you been a leader in other things? Do you work? Do you have experiences that are going to help you do things as far as being a veterinarian? If, after you do your bachelor's degree, then you're looking at another 4 years of medical school. And that 4 years of medical school, a lot of those nights you're spending studying 8 hours a night, and that's just not for everybody.
No. So obviously, those are some of the struggles you face. That commitment, not only to hours per night of studying, but as a whole, all those years of schooling. You want that discipline in there too. But once you get out of school and you have a job and you've achieved what you want in college and your degrees are all in place, what exactly do you do on the job? Then once you have maybe you're working under someone, maybe you have your own practice like you do. What do you do on a daily basis that some people might not think of?
Well, veterinarians are employed in a wide variety of careers. There are the regular veterinarians that probably most people are familiar with that do a lot of preventative care and elective surgeries, that kind of thing. I'm a veterinarian that works in an emergency clinic, and that means that we have to be skilled in treating patients that come in with multi-system traumas, or they're really sick because they have diabetes that's been left untreated. They may have cancer, and some of the side effects from that, and they may be going through chemo, and all that entails. So that's what I do as an emergency veterinarian, the exact same things that are done in human emergency rooms, but there are also other fields that veterinarians go into. I mean, they can specialize in cancer and treat just cancer patients, or they can be orthopedic surgeons, or they can be internal medicine specialists. And so all that requires additional schooling beyond the 8 years that we've already talked about. You can work for the CDC and work on things like epidemics. Some veterinarians work for the armed forces and take care of monitor the food supply for the soldiers overseas. So, being a veterinarian is much, much more than what I think most people kind of realize.
Oh, you're right. I mean, it's like your career goes on from there. You're not just a vet. You can expand and work in different areas and really specialize. But overall, since I am doing a project, how would you say that microbes, swabbing them in the cage of a hamster, and seeing how many colonies proliferate after that would relate to maybe something that's at your clinic, like say a kennel run and animals that are in the same environment who have multiple illnesses going on. How would that relate to what I'm doing in a bigger picture?
Well, your project is real important, and it's important both in veterinary clinics and human hospitals. If you're a patient in a hospital, whether you're a human patient or an animal patient, you're going to be more susceptible to any kind of bacteria that's there, any kind of virus. And so you find that if you're an animal in a veterinary hospital or a kennel or something like that, you're going to come across bacteria that you're not going to be exposed to, just in your home. And so how this project's important is that it helps identify the different kinds of bacteria that you come across and what they're susceptible to as far as being able to treat them effectively. And that saves lives.
You're absolutely right. That pretty much covers everything, and thank you for your time. I hope someone benefits from listening to this interview and getting a little more insight into what you do as a job, as a career, and how you've came this far and what you had to do. So hopefully, someone out there is listening and takes it to heart. So thank you.
Thanks, Kate, for giving me the chance to go ahead and talk about my career today.